3. MRI. MRI or magnetic resonance imaging used in hospitals and clinical settings to examine the patients for any injuries and diagnosing the existing severities. It uses magnetic field and radio waves to create detailed images of the body. The most common reasons for an MRI are ankle sprain and back problems. A special machine containing a strong magnet is used for an MRI test. The area of the body being studied is placed inside this special machine. The patient feels no pain in the procedure. MRI scans are digital images which can be saved and stored on a computer. This kind of data is easy to store and more durable, facilitating future study, research and cross-analysis. An MRI scan accurately detects disease and injury throughout the body and is often used when all other testing techniques and procedures fail to provide sufficient information about the patient's health or medical condition. Because of the use of magnet, patients with heart pacemakers, metal implants or metal chips or clips cannot be scanned with MRI to avoid the consequences. Neurosurgeons also use an MRI scan to evaluate the integrity of the spinal cord after trauma. It is also used with problems associated with the vertebrae or intervertebral discs of the spine. Important surgical decisions regarding the injury of the patient are much easier to take after the results of an MRI scan. Psychology paper number 1, Cognitive Science. Picture 2. MRI scan of brains and skulls. During the MRI, patients lie in a closed area inside the magnetic tube, because of which some patients may feel claustrophobic during the procedure. Mild sedatives can be used to overcome this situation. There are chances of patients feeling dizzy and aching back due to lying on hard bed for long times. There are otherwise no major side effects of an MRI scan. An MRI scan takes 30 to 40 minutes. An easier way to diagnose is through a CT scan, which takes around 5 minutes. 4. CAT scan. CAT stands for Computed Axial Tomography. A computed tomography (CT) scan utilizes a computer that takes data gathered from many X-ray images of bodily structures and transforms them into pictures on the monitor of the computer. Through CT scan we create a two-dimensional images of a three-dimensional object. A CT scanner emanates an array of minute beams right through the human body as it moves through an arc, in contrast to an X-ray machine which just sends one radiation beam. As a result, the concluding image is far more detailed than an X-ray image. A CT scan is generally used to diagnose problems of the chest, abdomen, urinary tract, liver, pancreas, gallbladder, adrenal glands, spleen, pelvis, arm or leg. CT scanning is advantageous as it provides a very characteristic 3D image of even smallest parts of the body such as soft tissues, the pelvis, blood vessels, the lungs, the brain, abdomen and bones. It is most preferable in the cases of cancers as the image helps a doctor confirm the presence of a tumor, with respect to its size and location in the body or organ. Scanning of the head can provide the doctor with important information about the brain. However, both MRI and CT scans do not give information regarding the activity level of the organ or tissue, hence PET comes to our rescue. 5. PET scan. PET is short for positron emission tomography. A PET scan uses a small amount of radioactive material tracer. The tracer is injected through a vein, usually on the inside of the elbow. The tracer travels through the blood to the tissues and organs. The patient has to wait for an hour or so for the tracer. Psychology. Then the patient is made to lie down on a narrow table that slides into a large tunnel-shaped scanner. The PET detects signals from the tracer. A computer changes the signals into 3D images which can be displayed on the computer screen. The patient must lie still during the test as movement can cause blur images. A PET scan detects the energy emitted by positively charged particles, positrons. Positron is produced by the breakdown of radiotracer inside the patient's body. This energy appears as a three-dimensional image on the computer monitor. The image reveals how parts of the patient's body function as break down the radiotracer. A PET image will display different levels of positrons in keeping with the brightness and color. The accomplished image is then examined by a radiologist who reports his/her findings to a doctor. A radiologist is also specialized in interpreting these MRI scans, CT scans, ultrasound and X-ray images. According to doctors, PET scans are complementary to X-ray or MRI scans, as a result of which these are used and each other. Doctors use PET scans as complementary to the main ones. Picture 4. A PET scan of the brain. A PET scan unveils the size, shape, positions and function of organs. The test can be used to determine brain function, diagnosis of cancer, heart problems, brain disorders, etc. The patient should be empty stomach for 4 to 6 hours prior to the scan. Little amount of radiotracer is used in the testing, hence it is to cause any trouble to the patients. 6. Memory in PET. PET is an excellent neuroimaging tool. Performance of any behavioral or cognitive task is marked by neuronal activity distributed throughout the brain. Changes in this neuronal activity are accompanied by changes in blood flow. PET can measure these changes accurately and thus can identify brain areas that are psychology. With respect to the domain of memory, this means that brain areas related to specific memory processes can be studied using PET. This can be done by making the subjects do memory tasks within the PET scanner. A study on patients with mild cognitive impairment reported that the patients can be warned of the development of Alzheimer's disease on the basis of results obtained from cognitive tests and brain scans. The PET scan on 85 participants with mild cognitive impairment demonstrated that those who scored low on a memory recall test and had low glucose metabolism in particular brain regions had a 15-fold greater risk of developing Alzheimer's disease within 2 years, compared with others in the study. About half of the older people with memory loss who meet the criteria of mild cognitive impairment will develop Alzheimer's disease within 5 years. Picture 5. PET scans showing a normal brain, brain with mild cognitive impairment and a brain with Alzheimer's disease (L/R). Source. As more and more PET data are collected right now, it is in nascent stages. Commonalities across groups of studies will emerge and suggest models of neuroanatomical pathways that underlie memory processes. At the most global level, the PET studies have demonstrated how multiple forms of memory processes might interact. Verbal working memory tasks, elaborative semantic retrieval tasks, and episodic encoding tasks have all activated similar left prefrontal regions. Processing that requires verbal elaboration, deep processing, appears to activate left prefrontal cortex, whereas well-automatized language tasks, shallow tasks, do not. Peterson et al., 1998. PET is very useful in studying different brain abnormalities. This can be done by comparing the activity patterns in healthy individuals with those of inpatients. For example, a focus seizure in an epileptic patient is often associated with decreased activity, which can be observed through PET. Altered PET activity can be seen in patients with psychiatric disorders such as schizophrenia and manic depression, as it can be seen in patients suffering from Parkinson's disease, epilepsy, multiple sclerosis, cerebrovascular disorder, Alzheimer's disease, etc. Psychology paper number 1, Cognitive Science. 7. 2 hemispheres. Imagine looking down upon the top of your head onto the cortex of your brain. You would observe that it comprises of two halves called hemispheres, one on the left brain, and one on the right brain. The left and the right brains are connected by an intricate network of nerve fibers called the corpus callosum. Ancient Egyptians were the first ones who noticed that the left brain tends to control the right side of the body while the right brain controls the left side of the body. Despite being almost identical in structure, both hemispheres function quite differently with very different activities. This is known as specialization or lateralization. Psychology. The left brain is the logical brain that looks after for words, logic, numbers, analyses, lists, linearity, and sequence. It controls the right side of the body. People for whom the left brain is dominant become scientists, lawyers, bureaucrats, accountants, architects, engineers, etc. Right hemisphere. The right brain is the creative brain that looks after rhythm, spatial awareness, color, imagination, daydreaming, holistic awareness, and dimension. It controls the left side of the body. People in whom the right brain is dominant become writers, poets, musicians, dancers, painters, spiritual masters, directors, actors or dramatists, nurses, etc. Medical studies of patients suffering from different kinds of brain damage depicted that certain complex psychological functions were lateralized on either side of the brain. According to the deficits that occurred in patients after the damage, it was observed that for most people the left hemisphere is associated with verbal abilities and speech, as well as mathematical and logical abilities. Therefore, due to damage in the Broca's or Wernicke's speech areas in the left hemisphere, the patient suffers from aphasia, the partial or total loss of the ability to communicate. Similarly, on the basis of the location where the damage has taken place, there might be problem in reorganization of the meaning of the words, in verbal communication with others, or in both functions. On the other hand, when the right hemisphere suffers from an injury, then the language functions are not ordinarily affected, but there is a disability in the perception of spatial relations due to which a patient might not recognize familiar faces or forget a well-traveled route. Although the two hemispheres have distinct and specific functions, the brain works as an integrated whole as the two hemispheres constantly communicate with one another through the corpus callosum. Because of this persistent communication among the hemispheres, most of the revelation of lateralized functions in humans was gathered by studying people suffering from brain damage in any of the hemispheres. The two hemispheres differ in terms of both the cognitive functions and in their links with positive and negative emotions. These studies have demonstrated that the right hemisphere is certainly more active in experiencing negative emotions such as sadness and anger. On the contrary, the left hemisphere is responsible for experiencing positive emotions such as joy and happiness. This all started decades ago in Italy. 7.1 Emotion and hemispheric activation. Psychiatrists there were treating clinically depressed patients with electroshock treatments to either the right or the left hemisphere, and they observed a striking phenomenon. The electric current temporarily disrupted neural activity in the targeted hemisphere. With the left hemisphere knocked out, forcing the right hemisphere to take charge, patients had what physicians termed a catastrophic reaction, wailing and crying until the shock effects wore off. But, when they applied shock to the right hemisphere, allowing the left hemisphere to dominate, the patients reacted much differently, they seemed. Psychology paper number 1, Cognitive Science. Unconcerned, happy, and sometimes even euphoric. Researchers noted a similar pattern of emotions in patients in whom one hemisphere had been damaged but lesions or strokes. These findings suggest that the left hemisphere activation may underlie certain positive emotions and right hemisphere functioning negative ones. To test this proposition, Richard Davidson and Nathan Fox 1988 obtained measures of frontal lobe activity as people experienced positive and negative emotions. They found that when people felt positive emotions by recalling pleasurable experiences or watching a happy film, the left hemisphere was relatively more active than the right. But, when sadness or other negative emotions were evoked by memories or watching a disgusting film, the right hemisphere became relatively more active. Moreover, the hemispheric pattern seems to be innate. Infants as young as 3 to 4 days old showed a similar pattern of hemispheric activation, left hemispheric activation when given a sweet sucrose solution, which infants like, and right hemisphere dominance in response to a citric acid solution which apparently disgusts them. Davidson and Fox also found individual differences in typical, or resting, hemispheric activation when they recorded people's EEG responses under emotionally neutral conditions. These resting differences predicted the tendency to experience positive or negative emotions. For example, human infants with resting right hemisphere dominance were more likely to become upset or cry if their mothers later left the room than were those with resting left hemisphere dominance. In adults, a higher resting level of right hemisphere EEG activity may be a risk factor for later development of adult depressive disorders. 8. Summary. MRI or magnetic resonance imaging through magnetic field and radio waves creates images of the body that helps the doctors in identifying injury with respect to location and severity. CAT or computed axial tomography makes use of X-rays to form 2- or 3-dimensional images of body parts. PET or position emission tomography uses radioactive material called tracer, injected into the vein of the human body, to produce a colorful depicting different activity levels image of the organ. PET helps doctors in studying brain abnormalities and functioning. The left hemisphere is called the logical brain while the right hemisphere is called the creative brain. The two seemingly distinct perform different functions. Brains are connected to each other by the corpus callosum. The brain cells within the hemispheres are connected through a thick band of nerve fibers, called corpus callosum. It is through this neural bridge that the two hemispheres remain in conversation with each other. Research shows that the left hemisphere governs positive emotions while the right governs negative ones. Psychology paper number 1, Cognitive Science.